the SI Joint Special Tests that are part of the LASLIT cluster for diagnosing or trying to rule in the SI joint as a pain generator, all right? So in the sequence of going through your exam with a patient, these are the tests that you do first just to see if the SI joint's generating pain, all right? So first one's Faber, put this leg down. Faber's pretty straightforward, cross over, let it drop. If that's not painful, it's okay to fix and add a little overpressure, right? Faber is, you have to ask your patient if they say, oh yeah, I have pain there, you have to ask them where, because Faber is also a test that's used for hip pain. So if they're complaining of groin discomfort with a Faber, that's not your SI joint, so that's not the negative test for SI joint purposes, all right? The Gainsland's test, scoot over to the side of the table, and they're gonna hold one leg and take the other leg, and you're gonna basically induce a pelvic torsion is basically what you're trying to do here. So I'm trying to push down into an anterior innominate on the left while I push him into a posterior innominate on the right. All right, you're creating a pelvic torsion, and you're seeing if that creates pain. You do the same thing on the other side. All right, that's Gainsland's test. The thigh thrust test, up here, you're coming straight down on the thigh. You're pushing straight down. This is also a ligamentous stress test for the SI joint, which is the whole idea. You're trying to see if there's pain being generated by stressing the long dorsal and possibly sacrotuberous ligaments as you push the thigh down, all right? That's the thigh thrust test. There's also an SI joint mobility assessment. If I put my hand along the SI joint so that the SI joint is sitting right in my fingers, like right here across my fingers, if I take his leg up and I push down, I can get a little bit of an appreciation of whether the SI joint moves. This is something that you can also do at different angles, because if I'm pushing here at about a 70-degree angle, I'm probably pushing up more into S1, whereas if I push down here, I'm pushing more into S2, and if I put them up here and push down, I'm pushing probably more into S3. So they are different, and they do mean slightly different things, and we'll go over what muscles might be tight and causing that at different levels, but just suffice it to say right now that at the SI joint for mobility, you're just pushing down through the thigh and trying to feel what's happening at the SI joint. The alternate way to do this is to put your hand underneath and then take the heel of your hand, you can put your leg down, and come on the side of the pelvis. The screen can't see me there.
Oh, right.
So my hand is underneath the sacrum, and the heel of my hand is on the front of the pelvis, and now I'm just pushing down. This is a general SI joint mobility test, because I'm just kind of going to feel what happens at the SI joint with my hand underneath. My hand is here, the SI joint's along there, so I can feel the sacrum push down, or feel the pelvis push down in my hand, but the sacrum not move. So you're feeling the difference of movement of the SI joint. But you don't get the S1, S2, S3, S1, S2, S3 thing there because the leg's down, all right? Last one, flip over to your belly, is just a sacral thrust. Hand on the sacrum, other hand on top, and you're just pushing straight down into the sacrum to see if you can recreate pain, all right? So those are the special tests for the SI joint. Definitely any one of those is fair game on the practical. So let's practice those, and then we'll talk about some cases and some things, and kind of see who's had what have we found in people. See if we can make some sense as to what we would prioritize with treatment. That's good, Ron.